All right. Hello, everyone. Thanks for joining. My name is Suzanne Morley. For those of you that don't know me, I'm a health promotion program coordinator with the Wisconsin Institute for Healthy Aging, also known as WIHA. And I'm glad to welcome you to this webinar about Falls Data 101. For those of you that maybe don't know, WIHA is a nonprofit administrator of evidence-based healthy aging programs and practices, and we convene the Falls Free Wisconsin Coalition, which is bringing you this webinar today. The Falls Free Wisconsin Coalition is a statewide falls prevention collaborative made up of local falls and injury prevention coalitions, community-based organizations, health and managed care providers, public safety and EMS, and then others who are part of a movement to reduce older adult falls in the state. If you're interested in learning more about the coalition, my contact information will be at the end of this webinar. So you can contact me if you have any questions. And then I'll also share a link to the coalition's website. So if you're not already a coalition member, you can sign on there and join in and be made aware of future learning opportunities like this, and then stay up to date with the statewide falls prevention work. A little bit more about the Falls Free Wisconsin Coalition. So if you're not familiar, this is the Falls Free Wisconsin Coalition structure. So again, WIHA convenes the coalition. We have a steering committee that meets every other month and carries out the statewide action plan. We have a few different work groups, one of those being the data work group, in which this webinar is brought to you today. We also have a couple other work groups, best practices and public awareness and advisory committee, and of course our coalition members. So there may be some changes to the structure in 2025, but we can invite you to consider joining a work group and actively engaging in the coalition's efforts. The data work group currently aims to collect and analyze statewide falls data and provide data customization for local communities. So more information on our 2025 structure will be coming soon as we kind of finalize our strategic planning for next year and release our year-end survey for everyone to provide us feedback on the coalition. Moving into today's speakers, you'll hear from myself, and I will be talking about what data sources are kind of out there to collect falls data. We'll hear from Ashley Hillman from Safe Communities of Madison and Dane County and Falls Free Dane, who will give an example of how they used data to drive falls prevention efforts in Dane County. Also hear from Haley Couch from the Kenosha County Aging and Disability Resource Center. And Haley will be talking about data collection in Kenosha County and a new initiative to watch for coming in the next year. And then Will Keene from the Wisconsin Department of Health Services will talk about the recently released 2023 Wisconsin Trauma Report, and then some available data through the Department of Health Services. So for housekeeping, if you could just remain muted throughout the webinar, feel free to throw questions in the chat throughout, and then there will be time for some Q&A at the end. We're kind of moving right into it. We know that there are available data sources to collect data related to falls and specifically related to older adult falls. So at the national level, we have the Centers for Disease Control and Prevention, or the CDC, and they host what's called Whiskers, which we are talking about here today. So the web-based injury statistic query and reporting system. I'm just noticing that there's a typo on my slide here, but I'll fix that later. And then also the National EMS Information System, or NEMSIS. And then there's also some statewide data sources as well. So the Wisconsin Ambulance Run Data System, or WARDS, the Wisconsin Hospital Association, the Wisconsin Interactive Statistics on Health Curie System, more commonly known as WISH, and the Wisconsin Trauma Registry. So these are some of the sources that we look at regularly for falls data. Some of the data sources provide national level, some state, some local, some all three, but we'll go into a little bit more detail on each in the next few slides here. So kind of drilling down, the Centers for Disease Control and Prevention has a few different links on their website for some ways to find falls data. So first link at the top kind of gives an overview, but then also provides statewide data, so the number and rate of falls and deaths as well. And like I said, they host the Whiskers data system. And then the second link on the screen there just kind of gives an overview of emergency department visits, hospitalizations, hip fractures, and traumatic brain injuries. So just a national overview of that data. So I am actually going to go through these websites now. You can kind of see what they look like if you haven't already. So that first link goes to this website here from the CDC and goes through the older adult falls data. So nationally, we know that falls are the leading cause of injury for adults age 65 and older. So you can see here, this just kind of goes through an overview of that data. Older adult falls reported by state. So you can see a statewide data as well, and you can look back a number of different years. So you can see here Wisconsin compared to other states throughout the nation and where we land related to it, the percentage of older adults who fell and the number of older adults who fell in a certain year. And if you go down a little bit more, you'll find deaths from older adult falls at the statewide level. And you'll see here, which we commonly report on, that the Wisconsin has, unfortunately, the highest rate of older adult fall deaths in the nation. So a number of different reasons for that. You know, different states have different reporting requirements for fall deaths. We often get asked, is it the snow and ice in Wisconsin? Is it Wisconsin's alcohol culture? So there could be a number of different factors that go into why Wisconsin has the highest rate of deaths. But we do unfortunately have the highest rate of deaths throughout the nation. So that data is on here as well. And then to go through and find the WSCARS data system, you can click here. And I'll just go through a couple of the different queries that you can make on WSCARS. So it's pretty interactive. I think CDC recently updated their website within the past year or so. So just by clicking on that link on the first screen, you can look here and find unintentional older adult falls. And you'll see different years here. And this is for the different months. So you can find that data. Other data that I had just pulled up looking at this query system. So you can query, you can see here filtering by a number of different things. So I chose Wisconsin here, unintentional fall for ages 65 plus for 5 years from 2018 to 2022. And this compares it to the US. So you can look at just Wisconsin, you can compare it to other states, you can compare it to the national average. So just seeing here data for the 5 years from 2018 to 2022, you'll see the number of deaths, the fatal injury rate. Again, looking at that compared to the nation, we are quite higher than the nation for the injury rate due to falls for older adults, the cost of those falls, and then drilling down even more, the top 5 causes of injury death in that age group. And you'll see here, maybe not to the surprise of anybody, that unintentional fall is the top cause of injury death for that age group, not only in Wisconsin, but in the nation as well. And then what the next 5 ones are, so unintentional motor vehicle, traffic, suicide, unintentional poisoning, and unintentional suffocation. And then it drills down even more here. So you can look at race and ethnicity, you can look at age, you can look at sex, you can look annually versus monthly, and again, comparing that to other states here. So there are lots and lots of great data here that you can look at the statewide level and compare to other states and the national level. The other one that I had just queried before this webinar is the number of injuries and costs related to older adult falls. So you'll see a number of different filters here. So I use the year 2022, the most recent year available. Fatal unintentional falls in Wisconsin for all sexes ages 65 plus. You'll see in 2022, there was 1,862 deaths. So you'll see medical costs, the value of statistical life, and then the combined cost. So on average, a fall death costs a little over $35,000. Total over $65 million. So seeing the sources here as well. So there's a number of other different queries that you can make on this WSCARS system right here. So again, all these links will be shared in the chat and afterwards if you're interested in drilling down more. But this is how you can kind of get a picture of that Wisconsin level if you're interested in looking at that, and then comparing to the nation level as well. That second link on the slide goes to this website here, also on the CDC, just sharing some facts about falls. So again, we know that nationally, the statistics are that more than 1 in 4 older adults fall each year. This kind of drills down a little bit more into some other just facts about falls. A 1 out of 10 falls results in an injury that causes the older adult to restrict their activities for a day or more or seek attention from the healthcare system. Every year nationally, there are about 3 million emergency department visits due to older adult falls, 1 million fall-related hospitalizations. You'll see some data here related to hip fractures and whether that's an emergency department visit or a hospitalization or a death due to unintentional falls. Again, more data related to hip fractures, and falls are the most common cause of traumatic brain injuries as well. So this goes into some more things, conditions that make you more likely to fall, after a fall, what can happen, and some additional resources here at the bottom. So these are some good resources to look at if you're looking again for that statewide picture or national picture, kind of explaining, you know, falls. We know falls are common, but how can we put a number on that and share, you know, the startling statistics? They cause a lot of hospitalizations, death, fractures, traumatic brain injuries, all of that. So that's a great resource here. Some other resources are the National EMS Information System. So that graphic on the screen here shows a 911 ambulance response involving an older adult fall. So it has several key steps to ensure timely and effective emergency medical care. So this demonstrates the flow of data as it's recorded, processed, and disseminated after an older adult fall is reported to EMS. We know that not all older adult falls are reported to EMS, so this kind of just captures those ones that are. So through the systems outlined, the data is stored securely to allow for retrieval, analysis, and reporting for clinical, administrative, and research purposes. All of the data elements are stored at the local level, and then subsets of this data are sent to the state and national EMS repositories. National data can be accessed online, and then state and local EMS data may be accessed through the state EMS office. And accessing data directly from local EMS agencies will include national, state, and local data elements. So you'll see here you have an older adult that has fallen, that's reported, that's called dispatch. There's an ambulance response, the care is provided, maybe there's a transport, and that's logged into the NEMSIS data system. The National Association of County and City Health Officials, or NACCHO, developed a really concise guide. So it's a 6-page document called Using NEMSIS Data to Address Older Adult Falls at the Local Level. So it's a 6-page report that provides an introduction for local health departments. Could also be used by aging and disability resource centers or other staff that are interested in accessing emergency medical services data to address older adult falls prevention in their communities. So this guide describes the characteristics of the data that may be available to evaluate the prevalence of the older adult falls that occur within their jurisdiction, and then also to monitor data trends over time for evaluation purposes. So again, I'll share the link to this report in the chat in a little bit, and then this will also be shared after if you're interested in looking into this data set a little bit further. Another data source that you can look at is through the Wisconsin Hospital Association. So the Wisconsin Hospital Association has access to hospital and ambulatory surgery center discharge sets and the Wisconsin Health Information Organization Data Mart. Healthcare data reports are generated each year, and you can also request custom data reports, but there might be a charge to get this data. I'm going to turn it over to Will from the Department of Health Services to talk about the next 2 data sources here.
Yeah, hi all, good morning. As was just being discussed, ambulance run data from EMS is really important when following falls data. The Wisconsin Ambulance Run Data System, WARDS, is a data system that all of our EMS agencies report their transporting ambulance runs into. So if a patient is transported by an ambulance, that data will be reported to the state. We've produced a 2022 EMS and Falls report that you can look up online. And at the beginning of the new year of 2025, we're hoping to have an updated set of data on that as well, so look forward to that. We have some of our data here in the PowerPoint just showing the number of EMS runs by year for falls. And you can see that it is a type of run that has been really increasing. 2023 saw a slower increase in the number of falls that we were seeing, but previous to that, we saw falls increasing at a faster rate than our overall calls. So falls are becoming more prevalent than other 911 calls. So I think that's something that's important for us to keep in mind. And these numbers are pretty staggering. You know, we look at this and we can see that there are over 120,000 EMS runs for falls every, in the past few years for our state. So this is something that EMS plays a large part in. And if you are working with a local health department or partner organization that's interested in more detailed EMS data, you can reach out and we can see if it's appropriate for a data use agreement, or if there's something that we already have that fits that bill. You can make an open records request and we can see if we have that information. So look forward to more data on EMS and falls coming out early next year. So besides EMS data, which doesn't really have, besides reports, we don't really put that much information out. There is WISH, the Wisconsin Interactive Statistics on Health Query System. And this is a really great source of information on how to, on how falls are trending, both within the state as a whole and from county to county. I can steal this screen quick. Awesome. I wanted to go through this and do a quick tutorial just to show everybody what the system looks like and how it works. There is a nice tutorial here too on the page once you get to it, but that's pretty general, and I'm going to just focus in on falls. So once you find the page, which I usually find just by Googling Wisconsin WISH, you can scroll down and find injury-related health outcomes. And from here, you have a couple of options. There's injury-related mortality, and there's emergency department visits, as well as hospitalizations. We really look at ED visits as well as mortality. Suzanne was talking about some of the state-level mortality data. This does let us go a little bit more detailed than some of the other data sources, with the drawback that it is only Wisconsin data. So other sources like WisCARS and Wonder at the CDC are really good for comparing us to other states. And then WISH is really good for comparing Wisconsin regions or counties to other parts of the state, or to just get that specific regional or county data. So we're going to go into injury-related emergency department visits. How these actually run between the ED visits and the mortality information is pretty similar. There's a couple of options here. Step 1, treated and released only, or all visits. I think both of these are useful to compare. For now, we're going to do all visits because we might be interested in fall injuries that end up being admitted to the hospital, as well as those that are treated and released. The downside being here with all visits compared to treated and released only is that you can have duplicate counts if a patient is injured and presents at one emergency department and then is transferred to another ED, say they get sent to a level 1 trauma center, they will be counted twice. So this is a measure of visits and not of total injuries. So that's something to keep in mind. The mortality data doesn't have that same double counting effect, which is good. And each of them are useful for answering kind of slightly different questions. So once we have our whether we're choosing ED visits or mortality selected, and we've chosen whether we want treat and release only or all visits, we can select the measure here. We can look at just the number. We have unadjusted rates, which is the number of fall visits divided by the population. And then we have age-adjusted rates, which try to take into account differences in ages. If you have a county that has a much older population, but they're doing really well on fall prevention, they might still have a high unadjusted rate that's due to the fact that they have that older population. If we look at their age-adjusted rate, however, it'll be a bit lower because it says, if they had a more standard population with a more even distribution of ages, we would expect them to have fewer fall ED visits because they're doing well on prevention. So both of these are really useful measures. Unadjusted rate is good for just understanding how many falls you're having per person, and age adjusted is helpful if you want to do some comparison between geographic areas and you want to account for the fact that there might be differences in ages, which you don't always want to account for that. It depends on what kind of questions you're asking. So I think that that's helpful to think about that, but we'll stick with unadjusted rate for now. There's a lot of injuries in here. The one we're obviously focused on today is unintentional fall related injuries. There's one more specific category, which is hip fracture among those with unintentional fall related injuries. So if you are a group that's interested in that specifically, can do that, but we'll stick with fall related injuries. We can choose a geographic area to break things down by. So, do we want all Wisconsin? Do we want a public health region? Do we want to just look at a specific county? Say, I'm in Dane County. Do we want to just look at Dane County data? It lets you break it down by urban or rural and RTAC region. If you want to compare one region to another, you have to select this here and then keep all selected. And later on, when we get to choose our rows and our columns, we'll want to make sure that it's broken down by area of geographic residence. So we'll go with RTAC region here, and we'll see what that looks like. For years, you can select one or more years by holding down control and clicking them. Again, this is something where at the bottom, we can say we want to break this down by not only region, but also by year. So we compare regions over years. For now, I'm just going to keep 2022 selected. And then there are age groups. Do we want to look at only older adults? Do we want to look at all adults? And lastly, you can also break things down by gender, by race and ethnicity as well, if that's a topic that you're really interested in. So once we get down to the bottom, we want to make sure that we are breaking this down in the way that we want to. For now, I want to compare RTAC regions. So I selected that, and then I select geographic area residence here, and I hit submit, and I'll put a table. And so here we can see the total number of entry ED visits, the population per region, and then that unadjusted rate, as well as this 95% confidence interval that kind of says, do we think that if there's overlap, could it be due to just random chance? If we were to stick Wisconsin in a Groundhog Day situation and run 2022 again, our falls might be different and they might fall into this 95% confidence interval. So that's kind of useful if you want to see, how much the fall injury differences could be due to random chance, or if it is, pretty starkly different. So this is really helpful if you want to look at your county specifically, your region specifically, and it can really help you compare um, across different places in Wisconsin, as well as from year to year. Or, if you're concerned about certain populations, women or men, or certain people of color, or white folks specifically, having fall injuries, you can break those down too and see how they're doing in your jurisdiction. Are they having more or fewer falls? Or, how are they trending over time? So that's a real quick overview of WISH. And as I said, there's a mortality section too that is pretty similar to this. So if you get the hang of one, you've gotten the hang of both of them. And that's a really useful data source that we encourage people to use, especially, if you're at a local health department or working in a specific region. It can help you get a better feel for what's going on in your region.
Awesome. Thanks, Will. That was a really great overview. I use WISH quite a bit, so it's a really great system to look at if you're looking at kind of drilling down a little bit more and wanting to get some more of that localized data. I am just going to give a very, very high-level overview of the Wisconsin Trauma Registry, and then Will is going to talk a little bit more about this when he talks about the Wisconsin Trauma Report. But the Wisconsin Trauma Registry contains injury information from patients presenting to local hospitals. So state statute directs all hospitals, ambulance service providers, and first responder services to submit data on a quarterly basis. And only hospitals with trauma level certifications are required to submit data to this Wisconsin Trauma Registry. Only trauma staff from the hospital can have access, but the public can view trauma data reports at that second link there. So like I said, we'll talk a little bit more about this when he talks about the 2023 Wisconsin Trauma Report, which has information on the trends of traumatic injury throughout Wisconsin and has a focus on falls. You can also gather falls data from local sources. So on the screen here are some examples of what data you might want to ask for when you're gathering local data. So for example, from a fire department, you might ask for data related to lift assist calls that maybe the ambulance doesn't show up to, that the fire department picks up. So maybe an older adult falls, but it doesn't result in injury, or that person refuses transport and they just need assistance getting up. So you can ask for that data from local fire departments. From local hospitals, you could ask for emergency department visits, hospitalizations, and transfers. People arriving by private vehicles, so that wouldn't be reported by ambulance runs. How many people are discharged the same day for a minor fall or admitted for a major fall? And you could also ask for data related to the cause or causes of the fall, but that might be a little bit harder to get. From EMS providers, you could ask for data related to calls that result in transport or calls that result in a denial of transport. And if you have community EMS or community paramedicine, also sometimes called mobile integrated health, you could ask for how often they are going out, so the frequency, and the reduction of falls for high utilizers. So depending on if you have community EMS available in your community or not. From your local Aging and Disability Resource Center, or ADRC, you could request data for visits and how often they're going out for falls assessments. And how often that fall assessment or request for a fall assessment is resulting in contact. So whether that's due to staffing, funding, or refusal from the person that they are aiming to see. I am going to launch a quick poll. Just interested if people on the call here have collected or used local falls data to drive prevention efforts in your communities. We'll leave this open for a little bit here. I'm going to leave it open for about 5 more seconds. I see the responses kind of slowing down now. Okay, so hopefully you can see that on your screen, but many of you have collected data, which is great. Some have not, and then some currently making a plan, so that's awesome. I am going to pass it over now to Ashley Hillman, and Ashley is going to talk about how they've used data to drive their fall prevention efforts in Dane County. Take it away, Ashley.
Thanks, Suzanne. It's good to be here today with you all talking about data. I feel like that's something we're literally always talking about in our work to prove our impact and to get grants and just to see how we're doing. So as Suzanne said, I am with Safe Communities of Madison and Dane County. I'm the Falls Prevention Program Manager. We are a local injury prevention nonprofit organization in Dane County. And I have the opportunity to coordinate Stepping On for Dane County, and that is kind of where I'm going to start with our data discussion. So many years ago, well, in 2015, we really started looking at data and how we can use the data that we have accessible to us to try to inform our programming. So the first thing we did was look at, well, for 2015, we mapped where we were offering Stepping On. And you can see some of the circles are a little bit larger. So that means a workshop may have been offered twice in that same location. So when we really looked at this data, we thought, gosh, like we're really offering this workshop just kind of along the isthmus in a very certain area of this very big county in which we live. So then we, went a layer deeper and thought, let's put some demographic data here. We really focused on African American population to see where we were reaching our older African American adults in Dane County. And this really opened our eyes to tell us that we really weren't. So there were, some gaps that we identified. And this really helped inform new partnerships. So we went to Sun Prairie well, if you know where, it's kind of in the northwest area of the map you see here. And so we went and we started having conversations about, who could we partner with to bring Stepping On to this area? What about South Madison? So we started having conversations there and really just more rural areas, period. We realized we were kind of in that more highly populated areas of Dane County with this program specifically. So we started moving out a little bit into some of those outlying areas to bring the program to people who may not be able to drive into Madison proper to get that. So that's where we started. Next slide, please.
So there's a quick question in the chat of what program did you use for the data mapping, if you know?
Oh, yeah, that's a great question. It's Tableau. And I knew enough to just be able to do this, so I can't help anyone with Tableau, but it's Tableau. That's the program that I used. So then in 2016, we started well, I should back up a little bit. So if any of you are involved with Stepping On, you know that it's evidence-based. We get really great data from Stepping On. And we hadn't really done much with that data in the past, but we started analyzing that participant data that we were getting from all of the workshops we were offering. And because we started, really asking ourselves, who are we serving through this particular program? And what might those gaps be that we can start to fill? So looking at the Stepping On participant data, we realized that we were serving a very specific population of older adults in Dane County. Our BIPOC community was really not served through Stepping On specifically. So we got creative and we started thinking of alternative balance enhancing programs that might appeal to different audiences and that might be of more interest. So the first thing that we did is we applied for a very small grant through Better Philanthropies, and we got some funding to offer Chicago Step-In specifically for older adults. So this is a style of dance that started in Chicago, obviously. And we found an instructor in Madison and asked if she would maybe instruct specifically with an older population. and she was teaching, all ages. And she said, sure. So we piloted this program. It was a huge success. And then, of course, how grant funding flows, it ebbs and flows. But we did realize that broadening kind of the work we were doing and the types of programs that we were bringing to the community was super important. So then, fast forward a couple years, and we partnered with Newbridge and actually got some grant funding from WEHA to support Activate Bailando. And with Activate Bailando, it was specifically focusing on Spanish-speaking older adults, and it was a dance class. And we did incorporate some assessments, not just balance assessments, but also some social isolation and loneliness assessments. And that was hugely popular. So we're looking at ways to continue to support programs like this to kind of fill those gaps, knowing that we weren't serving all of our community's older adults with Stepping On. And then one other thing that we learned through this is that, sometimes attending a 7-week workshop for 2 hours a week is just not feasible for a lot of older adults. So lots of older adults are still working. Some older adults are taking care of grandchildren. So we started having what we're calling evidence-informed lunch and learn events. So we'll go to senior housing, we go to faith communities, and we have, just a 2 or 3 hour program where we always provide lunch, and make it free. So there's no cost to attend. And we usually provide some resources from the CDC, from the Study Toolkit, and then have a PT or OT come and talk about falls and then demonstrate exercises. And it's an easier way, I think, of getting out in the community and meeting people where they are and not expecting them to always, come to us. So that was a huge kind of pivotal moment for us when we realized, oh, we can kind of adapt what we're doing and expand a little bit to better meet the needs. Next slide, please. And then EMS, we were just talking about EMS, and there is just oh my gosh, so much great data from EMS. So we started asking our local EMS if we could get calls for falls data. So we've been getting this data for several years now, and I just took kind of a snapshot of what some of that data looks like. So you see a heat map that shows where the darker areas are where more calls for falls are occurring. At the top, you see kind of trends. And then on the bottom left, it's where falls occur. So you can see, and most everyone knows this in this space already, that private residence is mostly where falls are occurring. But we have even data broken down by municipality, so we know how many falls are happening. And this has been a total game changer. So we have an annual event each year called Only Leaves Should Fall. So we try to look at this data, and we get it, we get our 2024 data in the earliest we can possibly in the year, or we get 2023 data, I'm sorry, in early 2024. So it's pretty recent. And then we use that data to identify, gosh, lots of falls are happening in this particular area of Dane County. Why don't we maybe have our annual event there, try to pull from that community? We always are thinking about Stepping On, and, gosh, like we don't have a program in this area. There are lots of calls for falls. What's going on there? Let's go talk to some partners in that area. And then the more informal lunch and learn events, the community-based events I was just talking about, we've used this data to really help us drill down on where those events are held. And we're partnering with the city now and EMS to come and help us with these events. And we're planning an event for next year. It's a senior housing complex where lots of calls to EMS for falls occur. So we're going to maybe partner with EMS and have some sort of falls program and lunch, of course, and just bring programming to the communities that we're trying to serve in a culturally relevant way too. That's something we're always mindful of. So data has played a huge role in our kind of adaptation over time of how we have provided services and programs to Dane County older adults. So last slide is just kind of what we've learned. and this probably sounds very basic, but start with what you have. So we started really small. We knew where we were offering stepping on. So we mapped that out. And then we took it a step further. We overlaid the demographic data, and then we took it a step further and, thought outside the box a little bit. So we learned from that. We adapted with these new programs like Chicago Step-In for older adults and with supporting Activate by Londo. We learned what works and what doesn't work and made adaptations again. And then all along the way, we've continued to collect data and to look for new data, and to use that to leverage partnerships and to leverage funding and resources so that we can just do a better job at serving our community's older adults. So that's kind of in a nutshell. I know several questions have popped up. I don't know if you want to do those now, Suzanne, or wait till the end.
Yeah, I think we'll wait to the end to do those just for time's sake, since our Haley and will have some time to speak. But thank you so much, Ashley, for sharing a great example of using data to really drive your falls prevention efforts in Dane County. All right, so I'm going to pass it over now to Haley, and Haley's going to talk about how they've kind of collected data in Kenosha County and their exciting future plans. So take it away, Haley.
Thanks. So I'm Haley. I am in charge of the Kenosha County Falls Coalition, as well as the fall prevention program here. And I'm also in charge of the health and wellness program, so stepping on, and then healthy living with diabetes. Go ahead, Suzanne. I'm ready. So in I believe August of last year, Aurora Kenosha had applied for a grant to connect the dots here in Kenosha. So getting every single community partner, so all 7 EMS departments, both hospital systems, the ADRC, medical examiner, dispatch, and a bunch of other community partners involved to help get falls sent to the EDRC so that we can assist them in their home. And I'll go into that in just a little bit. But so far, we have had 1 EMS department added into the system. So I will just kind of explain how it goes and what it looks like on our end and what it looks like on the EMS side as well. Go ahead. So when somebody falls in their home, out in public, or even in an assisted living or memory care facility here in Kenosha, and they can't get up by themselves, so 911 is called, EMS assists them, and they go help them either with a lift assist or treated, transported, and sent to the hospital. The faller is asked by the fire department or the EMS, whoever is assisting them, if they would like a follow-up from the ADRC. If they say yes, I get a whole generated report for either a yes or a no, basically saying what they would like assistance with or what they might need in their home. So if they need something here from our loan closet, we have a loan closet at the ADRC where we loan out durable medical equipment and incontinence supplies. We just don't want those back, but we give them anything that they might need for free. They can keep it for however long they need it, or if they want to return it whenever they're done using it, they're more than welcome to do that. And then after I get all the information, I assist them with whatever it might be needing. So if it's a home visit, to go through their home, assess to see if there's any issues. So throw rugs, bathroom, safety, so grab bars, toilet, shower chairs, anything that might be safer for them to be as safe and independent in their home. So when EMS responds to a call, go ahead to the next slide, Suzanne. So we use Image Trend here in Kenosha County for fall reports, how they get sent to the ADRC. So what will happen is when the fire department or EMS goes to the call, this screen will pop up, and if they say yes to a fall, it'll go to another screen where it will allow them to kind of ask the question for the consent. So they have to give verbal consent to agree to the program or the fall prevention program to be sent to the ADRC. So it looks like this. So when they do click the follow-up, it'll come to another box and it'll just say what happened. So we put tripped on a cat. Obviously, they would go into a little bit more detail. Their time is limited, so they try to do as best as possible to say what they do need or what they don't need. And then we go from there. And then after they fill out this box, it'll go to a phone number, and then it'll just generate a phone number that they get to put into the system. So this is what it looks like on the EMS side. On the ADRC side, it will look like a report that it will be emailed to the ADRC me every single day. It will look just like this. So it'll say their age, what gender they are, what happened to them, and then what if they went to the hospital, what hospital system they went to, and then if they consented to a follow-up, yes or no. If it says no, then we just add it to our daily spreadsheet that we have. If it says yes, it'll look like the next slide where it'll have the name of the person and their phone number, and then just say what they would like to see or what they would like to have with their home. So we kind of collect all this information, and then at the end of the year we go back to the Falls Coalition and we just kind of talk about where we're seeing a higher number of volume with fallers and like if they're going to the hospital more, and then seeing what the need is in the community. So that's basically kind of the overall gist of how the data is coming in for Kenosha County. By the end of the year, we will have all 7 EMS departments sending reports. Right now, we only have 3, and we'll have the rest of the 4 by most likely December 1st. We're working on the last little bits of getting the information. So that's our data. And then coming up next summer, we are going to be starting a Falls Fatality Review team here in Kenosha County. So I am working with the medical examiner here with fall fatality reviews, just to get the fall deaths that we've had in the past year. So we'll be picking 1 or 2 and going through them to see how we can help better the community when it comes to falls, and seeing how we can better when it comes to either strength and balance or helping with mobility devices to make it safer for those that are living in their home by themselves. If you have questions, I'll put my email in the chat, so that way you can email me if you have questions about anything that I talked about. Oh, thank you. Stanley's hanging out right there too. Thank you.
Awesome. Thanks, Haley. Super, super excited. Great to hear what's happening in Kenosha County. And we'll be really interested to see what sort of data comes out of this falls fatality review team. It's pretty innovative. Maybe the first definitely the first in the state, as far as I'm aware, maybe the first in the nation. So really excited to see what kind of data is going to come out of this and how it's going to really drive prevention efforts in Kenosha County. All right. I'm going to pass it over now to turn it over to Will, who's going to talk about the 2023 Wisconsin Trauma Report. So Will, take it away. Do you want to share your screen?
Yeah, that'd be great. Shared here. Yeah, so every year we publish some of our trauma data. The most recent report for last year's data came out this summer. And, I'd encourage people to read through it. It has a lot of interesting information on trends and what we're seeing in the state. But there is specifically a focus on falls section to it. That's 3 pages long that details what we've been seeing in our trauma system. As it was shared earlier, this is only our trauma hospitals that are reporting this information, but there are going to be hospitals that see our more severe injuries. So when you see this data, it's typically not just somebody who is treated and released with superficial injuries or no injuries that was just looking to be checked up after a fall. These are going to be injuries where there are more severe injuries. It could be broken bones, it could be cuts or scrapes from the fall. So that's something to keep in mind too, is, if we're looking at this versus WISH with hospitalizations and ED visits, some of those might be less severe falls. And these are going to be the ones that result in pretty significant injury. So there's a few really interesting graphs in here that I like to bring people's attention to is the adult falls by month and over time. People always think that we have more falls in the winter because people are slipping on ice and snow. But we don't really see too much fluctuation by season when it comes to falls. And part of that is because, if we look at that bottom graph there, text might be a little bit small for you, but it shows our injury locations in 2023. And most of our falls, by far a majority, most of our fall injuries happen at private residences. These are older adults who are falling in their own homes or the places that they are living and having resulting in injuries there. So that's something that I think is perhaps not surprising to you folks that are, really in tune with fall injuries. But I think it's surprising for folks that don't really know too much about what fall injuries look like. They think that oftentimes it might be like snow or ice that is driving these fall injuries, and really is people falling in their homes and becoming injured there. So these are really interesting for me because we can see that upward trend over time over the course of months, and look for trends in time of year which don't really seem to be that present, and then the injury locations, which I think is unexpected for some people. We also want to break this out by age group. We have our 20-year-olds to 54-year-olds with the lightest color, or 55 to 64 with this second lightest color. And those maybe have went up a little bit in the past few years, but they are pretty steady compared to our other groups, which are 65 to 74s and are 75-year-olds and older. That last group who, they make up a majority of our fall injuries, and we are seeing more and more falls in that age group as the population ages, but also because falls are just becoming a little bit more common over time. So this is a really interesting group, and I think it helps break down the information on the population that is falling in our state. The high fall numbers are really driven by these older adults. There's links to some of those resources in here. We've got the Wisconsin Institute for Healthy Aging's website linked here. So there's some useful information here that you are, you might be familiar with already, but it's worth checking out. And, if you share this to other people that aren't as familiar with this, they have some resources to look at here.
David, you know how to make this go up?
Lastly, we have a map of the age-adjusted fall rate by county for Wisconsin for our trauma visits. So this is something that's useful. You can look into WISH to see kind of the general trends, and this really tries to look at being trauma data, the more significant injuries. So it's useful for comparing your state to other states, or your county to other counties, or your part of the state to other parts of the state when you're thinking about those fall rates. One slight disclaimer here is that in the far northwest and western part of the state, we end up having some patients that get transported to Minnesota, especially when we're talking about the northwestern few counties. There's a level 1 trauma center across the river by Lake Superior in Minnesota and Duluth, and so there might be an undercount in some of these counties up here. But otherwise, we're pretty confident in these numbers. One thing that always stands out is Menominee County, the American Indian population there has a lot higher rate of fall injuries, as well as higher rates of other injuries than the rest of Wisconsin. But I think regardless of where you're at in the state, this can be helpful to kind of understand how you stand in your county when it comes to fall injuries. So encourage everybody to check these out. There's a lot of other interesting information. There's a lot of data in our trauma registry. And so if people have thoughts or questions or other things that they'd like to see on falls from the trauma data, we are always open to suggestions for how to improve this report. So, feel free to reach out to us or find your trauma system contact or your RTAC coordinator and let them know if you have questions on the trauma system or trauma data.
Thanks, Will. There's a question in the chat. Hospitals share the number of patient falls that occurred in the hospital.
Yeah. I don't know if we have specifically how many patient falls happened in their own hospital. Again, because I'm sharing the screen, it's kind of small, but in this graph, we do have fall injury locations, and we have healthcare facilities, which are, pretty low. It still happens, and it is still, a decent number of fall injuries there. So that's something that we, have some data on. I'm not sure if we have data specifically on from hospitals on how many falls are occurring in their own facilities. That's something we could look into. I'm sure that's a big patient safety topic for hospitals. So it's something that they are likely monitoring and making sure that they're addressing if they're seeing multiple falls in their facility.
Yeah, maybe another question that you can ask your local hospital too if you're interested in getting that data. I know we're getting really close to 11 o'clock. Peter, I do see your other question here related to most likely to fall categories do not include cognitive impairments or dementia. Was that related to Ashley's presentation, or was that related to data that Will had shared previously? I just wanted to make sure that one was covered. And I see Ashley has been responding to all the questions in the chat, so thank you, Ashley.
Yes.
It was related to Ashley's data?
Yes.
Okay. But Ashley, I don't know if you're able to address that one as well. Want to just quick share my, I see you're coming off a.
I'll do it here.
Okay, awesome. I'm just going to quick share my screen. I wanted to include some discussion, but we're running out of time with all the great information that was shared. So just want to end with thanking you for joining us about this discussion about falls data. Thank you, Ashley and Haley, for sharing some local examples and how you guys are collecting that at the local level. Thanks, Wilt, for sharing your expertise on how you can search for falls data in the state. So again, thank you all. Encourage you to visit fallsfreewisconsin.org. We have a data page on there as well that goes through some of this information in more detail. It is 11 o'clock now. I will hang on if there are some additional questions, but thank you all for joining, and you can see my contact information on the screen as well if you have additional questions. Thanks, everyone.